committee was created after several discussions between different persons, vets, farmer association, researcher, academia, and we were all agreed with a consensus that we need to increase awareness about qfever. It's very interesting to see that we have a lot of data published in France, but also in other countries, in cattle, sheep, goats, etc. But it seems that the practical information are not available or are not, I would say, known by the general farmers and also practitioners. So the main idea was to increase awareness. So this is a survey that we done last year with an independent poll institute, Via Voice, to have, I would say, independent survey. And so we decided to do the survey concomitantly for physicians, vets and farmers, and especially in semi-rural area. And so the questionnaire was divided in three parts. The first part devoted to general knowledge about qfever, the second one focused on the perception of the risk for zoonotic disease in general and qfever in particular, and the last part was devoted to control action and control measures that we can put in place. And interestingly, especially regarding the first part, I would say in my view the main result of the first part is contradiction results. I mean, on one hand, both farmer and vets and physicians say that, okay, I know quite a bit qfever and maybe I was confronted to qfever, but the percentage that they reported is far from what it should be when we look at the data about the prevalence and also the ranking of qfever in terms of abortion. So, I mean, to the best of my perception, I think it means that it's underdiagnosed. Okay, maybe the person heard about qfever, but they don't know exactly what are all the clinical signs, especially beyond abortion. Abortion was well known, but impact on reproduction, fertility, it was almost never reported by the farmers and the vets. And for physicians, I think regarding the knowledge of qfever, once again, which is interesting, is that they never noticed some caution that you need to have with at-risk persons, such as person with valvular disease or pregnant women, etc. They were just talking about pneumonia. So I think that we need to increase awareness about all the clinical signs and at-risk person. And regarding the last part, regarding control action, it was interesting to see that only 50% of the farms that experience qfever put control action in place in the farm. So in 50% of the case, they know that qfever is here, but they did nothing. And when they put measures in place, vaccination was only implemented in 25% of the cases, so there is room for improvement here. For me, the first bottleneck is abortion and reporting abortion. When we do conference on qfever, usually I begin first by abortion because this is really the first sign. Everybody is, I would say, not comfortable with the diagnosis of qfever, so I think first is convince farmer, cattle farmer, goat farmer, sheep farmer to report abortion. Then we need some, I would say, tools to increase the likelihood of finding qfever. So we are lucky because we have very good PCR, we have also standards for ELISA methods, etc. So we need to set some standards or at least recommendation for diagnosis, and then maybe to promote very simple list of action that you can put in place. We are very lucky because we have a very effective vaccine with a demonstration of efficacy, especially in infected herds, which is pretty unusual because usually when you have a license, it's not done in that way. So I think that first, increase reporting of abortion, ensuring good diagnosis and put control action and especially vaccination.